We have with us today Rachel Dow. She's part of the Adolescent and Young Adult Cancer Coordinator at John Stoddard Cancer Center, as well as Blank as well. Here to talk about a very important topic. Parents, pay attention. Kids, if you're watching out there, although you should be in school. And I'm going to totally mess this up. Human papilloma virus, or HPV is the easiest way of saying it. We want to talk about what that is and how we can be vaccinated.
Exactly. HPV is a virus that a lot of people don't realize it's very, very prevalent. It's very, very common to have it, and that there is a vaccine that can help prevent it. So the vaccine can be given at ages 9 through 26. However, it's best if you get it at age 11 or 12 because that's the age that produces a higher immune response.
Now, according to the CDC.gov, they're saying this is the most common sexually transmitted virus in the United States.
Yes.
That's huge.
I mean, it's isn't it 1 in 4? 1 in 5 people have it now, and you don't necessarily know that you have it.
A lot of people don't realize that they have it, and they will have no symptoms, nothing like that. There's actually not a test for males to find out if they have it.
Because they're the ones that pass it on. Like, women don't just naturally have it in their bodies. It has to be.
Nobody does. It is a sexually transmitted disease. However, it's just so prevalent and so easy to get that it's just important to get immunized before that's even an issue.
And you know, I've learned this as well, and you mentioned it, that this vaccine is not just about HPV. It's also about what could happen if you have HPV untreated, which is?
It's cancer prevention. So cancer happens, there's several different kinds of cancers that happen to individuals, both males and females, that are HPV related. Wow. They're just starting to study and learn that that's even a higher prevalence than we ever thought before. So the big message here is that getting the vaccine is cancer prevention.
If you already have HPV, let's say you're between 9 and 20, does the vaccine then get rid of it, or is it only preventative?
It's only preventative.
So if you have it, you have it.
Yes.
Interesting.
So the earlier the better.
The earlier the better, again, at age 11 or 12, those preteen years.
I was going to say, why is that the time that you really want to focus in on?
That's the age that they found that just has the best immune response. So that's where it's going to be the most effective at that age, before really anything happens and before you kind of get to the teenage years. However, it's still available, so if you're 14, 15, up to 26 years old, you haven't gotten it done, still a great idea to do it.
Now, I feel like, and you said new research is coming out all the time, but I feel like this really wasn't highlighted, and you didn't see the posters in your doctor's office until I was well past the years of being able to get it done. If you're past 26, there's just really nothing you can do.
There really isn't. In 2007 was when they first came up with the immunization, so it's still kind of a more recent thing, and they've had a couple of different series on that. But so it's really just kind of a new thing that they're learning about it, that they're talking about it, and that it's available. But we know it now, and that's why we're out educating and talking about it.
Well, and you know, I am not in the medical field, but if I remember right, a standard Pap test will show precancerous cells that could be something that HPV causes.
It can, yes.
And so if you are past your time, is it correct to say make sure you stay up on your testing to find out if you get precancerous cells?
Very important.
Yeah.
And this, again, males and females?
Males and females. So a lot of people think that it's just girls get HPV-related cancers, but guys can get that too. Cervical cancer is one of the highest kinds of HPV-related cancers, which is why it's kind of associated with females. But again, boys can they can spread it, but they can also get HPV-related cancers.
Wow. So men and women alike, go and talk to your doctor about it? I mean, do doctors bring this up in conversation when you reach a certain age, or is this something you need to be going to your doctor and saying, hey, I need to get this vaccination?
I think both. Pediatricians are doing a really good job of trying to educate about this and talk about it as cancer prevention, but I think it's always great to kind of know and go in with information and ask about it. So pediatrician, if you're not going to pediatrician anymore, you're in those 20s, it's okay to talk to your doctor about that too, and they should have the information.
And you have an event coming up.
We do. Not us, but we are partnering with Des Moines University called to put on a documentary. They're putting on a documentary called Someone You Love, the HPV Epidemic on October 28th. And really it's a really powerful message that talks about HPV, the risk factors, and then also the ladies that you see on there have been affected by HPV related cancer. So it goes through their story, what they've been through, and kind of what if they had known or if this was available when they were young, what it would have prevented for them.
I mean, a friend of mine in Los Angeles went through it, and she was told by her doctor that it is so prevalent now, they're considering not even calling it a sexually transmitted disease, that it's just so easy to catch.
Right.
And so many people have it. Is it 1 in 3, 1 in 4? Am I getting that wrong?
That's about right. They're still kind of studying that,
Yeah.
but it's really any sexual or intimate contact really, and it is so prevalent that anymore that's not the focus. It's the fact that getting this immunization is it's cancer prevention.
Do you think this will become eventually something like MMR, where your kids reach a certain age and you just go and have this done as just
The vaccination?
a matter of course? It just
Some states are talking about it. That's not something that Iowa has done yet. But when you look at our rates, like our immunization rates for girls are 27% and 15% for boys. I think that, to increase that, that's something that might be talked about.
There's some room to improve there.
A little bit.
Obviously, we have a great event coming in October, but if parents are out there or hearing this or like we want to do more research and find out what it's all about, is there a website you recommend checking out?
The CDC website's great. They've got You Are the Key is kind of you can see that on the billboards that are out there. But the CDC website has so much great information it's for parents, it's for doctors, for pediatricians. I recommend everybody to go to it.
All right, Rachel Dell giving us some great information along with UnityPoint Health this morning. Thank you for joining.